Great. Hi, everybody. Thank you for joining us for this discussion. This discussion is being recorded, so I would like to ask that if you consent to be recorded during this discussion, to please give a thumbs up either on screen or with the reaction button. Let's keep taking a quick look. Okay, great. It looks like everybody said yes to being recorded. If new people join, it is possible I will need to chat them to get their consent to be recorded. So that's what I'm doing if it looks like I'm distracted. But with that, I'm going to turn it over to Kathy to introduce the topic and lead us in this discussion. Thank you so much, Kathy.
Well, hey, gang. I guess I'm glad I sent out those invitations this morning. I kind of had something a little different planned, but since we are such a small group, I would really kind of like to have everybody introduce themselves. And I know half of you, but just to have that on here so that people who are listening to this later will have an idea of who's having this discussion with them. So if you'll introduce yourself and say where you're from. If you're with an agency or organization, that's great. And if you live in a rural area or you live in a metropolitan area, and you know, if you have experiences in rural area, maybe you grew up in a rural area, just add that in, just so we kind of know who all is on the call. And Ming, we'll start with you because you're first on my screen, so we'll let you go first.
Sure, happy to. Thanks, Kathy. My name is Ming. I use he, him pronouns. I am an attorney at the National Center for Lesbian Rights. And I'll say my connection to the HIV work is mostly through our immigration project. We represent a number of HIV positive individuals who are fleeing persecution or trying to avoid being returned to persecution in their countries of origin. And that's mostly my connection to HIV related work. I am based in a more urban area. I live in Oakland, California, and I no longer work physically in our office that much, but when I did, our physical office was based in San Francisco, but I have been leading our Rural Pride project for 5 years now and was working on it for a couple of years before that, so have really had the privilege of traveling to and meeting a lot of folks in rural areas around the county, and just kind of, mostly having kind of informal discussions with folks about where things are at around HIV prevention. I feel like this is often a topic of conversation for gay men, and have been surprised sometimes at the level of difficulty people have accessing care and even just basic information about prevention. So, yeah.
For sure. Well, that's awesome. Bob, you're on my screen next.
I'm Bob. I'm in Central Arkansas in Sherwood. And so obviously that makes me rural just to begin with. Our entire state has about 3 million people, and I'm being kind to the state because we're a little less. And we're a very vast state. I'm HIV positive, was confirmed positive in 2003. In 2000, I was doing some work with HIV and testing and counseling and working with the state, trying to be on their boards and things like that. And I found that we had some real issues and problems. First, it was ethnic. You know, if you were one ethnicity, you couldn't get treatment if you or whatever. And so the whole thing got very convoluted, and we fixed some issues and others popped up. And we're now in a different era where a lot of the folks are on PrEP, but PrEP is still a difficult thing to get in some portions of the state. And others are being treated, but it's become, the treatment is there, here, you're positive, take these pills, go and sin no more kind of thing. as opposed to referring to support groups and things that are also peripheral to specifically HIV, but emotionally they have a lot to do with that. So we have two major groups in Arkansas that are dealing with stuff. One is local in Pulaski County to the Little Rock area and deals with generally African American issues. And then the other is throughout the state dealing with transportation and entry to care. So, and I am not involved other than on the peripheral. I did a lot of volunteer advocacy until I turned 62. And now that I'm 71, I'm just too old. So I'm traveling. And back to you, Kathy.
She does a lot more than that, but that's okay. Tyrone.
Hey everyone, I'm Tyrone Hanley. I use he and him pronouns. I'm the Director of Racial and Economic Justice Initiatives at NCLR. Prior to going to law school, I actually did HIV prevention at an LGBTQ youth organization here in DC for 3 years. We also moved to DC to do an HIV program, and I worked at an organization that was focused on sex workers and drug users. And then at my time at NCLR, for a while, I was actually doing our work around HIV decriminalization and helped started a campaign End Bad HIV Laws with the HRC and the Center for HIV Law and Policy. So I'm really excited to learn more about issues impacting rural folks. And yeah, thanks for having me here.
It's Miss Miranda.
Hi, everybody. Miranda Fano. So I'm the HIV/AIDS program coordinator for Bay County DOH. So we have 6 counties in our area, 5 of which are very, very rural. Bay County is rural, but we have a little bit better of a transportation situation in Bay, so we can get clients to and from. But here at our health department, we offer test and treat. We do PrEP, we do NPEP, we do, oh gosh, we just started DoxyPEP. So we have rapid testing Tuesdays. We try to encompass everything because it's not going to work if we don't have all of these key pieces. So with a staff of RNs, we do DIS work. We've actually got a HIV DIS that goes out to find and do the test and treat. Usually within 7 days, getting them on medicine and doing telehealth out in the field. So yeah, it's been about 10 years since we've been doing this, and you know, hanging out with Kathy at Women's Reach and getting these ladies together and back on treatments and you know, other life ailments that come in. So
Miranda,
happy to be here.
Miranda, since most of these folks are not from Florida, particularly the ones that are putting this on, give them an idea of how many miles geographically we're talking about when we talk about service area.
Oh God. Okay. So
in hundreds, but in their mind, 6 counties may be, you know, 25 miles. It's you know.
So our 6 counties, gosh, so from the coast to the state border of Alabama is probably an hour and a half. So if you're traveling from Bay County to go to Jackson County to the outer sides is probably an hour and a half, hour and 45. If you're looking at from east to west, it's probably 2 hours. And that's not the back roads, dirt, pigtail, you know, trails and all that stuff. And just the transportation. So we only have 1 county, Bay County, that has any kind of trolley system or bus system. We do have Jackson County that has, if you have Medicaid, you're able to, you know, get a ride to come into the health department, but you have to do it 2 or 3 days before. They have to be scheduled. So folks that, you know, are living on property in the middle of nowhere that catch rainwater and that's how they're living, homesteading, we have to go to them. So if we have any field visits, we usually allot 3 hours to get there, get the doc on, if we need to draw blood, if we need to do anything out in the field. We have an RN that does that. But it's a good half a day to visit one client if we're doing some field work.
Yeah, and I think that's just really important for you guys to understand, because I'm going to kind of lay out the state for you, but our issues are tremendous compared. You know, when people say transportation in a big area, you think, oh, a bus pass will fix that, you know, but that's not, those are not the things that fix things in rural America, right? Monica, you're an interpreter, but are you in Osceola? Is that where you said you were? Oh, maybe they can't hear me. Are they like, they're on another channel? Is that it? Okay, that's okay. So one of them are in, okay, Monica's in Osceola County. So that's a whole other rural kind of area, as I was talking about earlier. That's Central Florida. She's in Kissimmee, St. Cloud. For many years, I was in Lakeland, which is about 30 miles, 40 miles from where she is. And so you have Orlando Metro, right? And you have Tampa Metro on the other side. But then you have about 9 counties in that area that too have no bus service, no, the nearest care for an HIV positive child, if you're in Polk, Collins, and Hardy County, is 90 minutes to 2 hours away. The nearest provider, because you either must go to Orlando or Tampa. So that's a big thing there. So Malika. Oh no, maybe I pronounced that wrong.
It's okay. It's Malkia.
Okay. Sorry.
It's okay. Malkia Hutchinson. My pronouns are she, her, hers. I am the Director of Media and Communications with NCLR. I live in a suburb outside of Houston, Texas. Grew up in North Texas, so not, suburb or not rural at all, very suburban, but I'm very interested in this topic. I was a Peace Corps volunteer doing HIV education and outreach in Swaziland years and years ago, and also did a lot of education and testing at Whitman Walker Clinic in DC for a few years. So yeah, I'm really looking forward to what this conversation will be.
Awesome, fantastic. Well, I am going to act like the rest of you don't know me, and at least do my background so that these guys hear it and it's on the recording, so that when other people listen, they kind of know what we're going to discuss and that kind of stuff. So I am Kathy Robinson Pickett. I currently live in the Fort Myers area, which is Southwest Florida, almost as far south as you can go on the west side of Florida. I was born in North Florida. I am 7th generation native Floridian. We are an endangered species. I was born in Jacksonville, grew up in Jennings, which is the last exit on I-75 as you leave the state. When I grew up, we didn't have a stoplight. We did have a flashing light, and completely farmland. There is a stoplight now in my hometown, but there's still not a fast food restaurant of any sort in that area, but very, very rural. High school and college in Tallahassee, go Noles. And then the rest was more in central and southern Florida of my life. The Clewiston area, which is the bottom of Lake Okeechobee. If you look at the state of Florida and you see the big black hole in the middle of the state, that is a lake. And at the bottom of that lake is the Bubba Redneck capital of the world. And I can say that because my children will tell you I'm a Bubette, but it is very rural and very, it is the belt of the Bible Belt, the buckle of the Bible Belt of the state of Florida. And then Lakeland, I was on staff at Florida Southern College for many years in Lakeland, Florida, which also is a central Florida and rural area. So as I was telling Ming before we started, Florida has 3 very distinctive rural populations, and we'll talk a little bit about that in just a few minutes. So how my world became HIV involved is that in 1991, I was a teacher. I was living in Jacksonville. I had a daughter. I was 6 months pregnant with my son, and my now ex-husband, and I went to have a life insurance physical done. This was 1991. For most of you on here, you need to have some context in mind to remember that that was before cell phones and before computers. Okay, so none of that. Even MacGyver didn't have a cell phone in 1991. So one day my phone rang, and it was my doctor, Mark. Mark and I had been friends since college. I had known his wife since ninth grade, so we're really good friends. And Mark said, Kathy, can you and Dan have lunch with me today? And I said, well, Dan's in Atlanta on business, but I'll come by and bring Lindsay and we can go to lunch. I went with checkbook in tow, quite sure he was going to hit me up for a donation for Save the Whales, Girl Scout cookies, whatever the charity of the week was at that time. When I got to his office, it was empty. There was nobody there. And I'm like, man, is it a holiday I forgot about or something? You know, his receptionist sent me back to the back. And I was sitting behind his desk just like this, and I was reading a McCall's magazine, a real life magazine. And Lindsay was playing around on the floor, and the office door opened, and his nurse was behind him, and they were both as white as a sheet of paper. And Mark said, oh my gosh, Kathy, I don't know how to tell you this, but you and Dan have AIDS, and I've got no idea where that came from. He began to
Sorry
cry.
to interrupt. The interpreters are asking you to slow
Slow
down.
down. Sorry. So it's Bob. Bob put in big letters, holy moly. He said to me, do you have a will? I mean, really, that's the exact words. And he began to cry. And they both ran the room and walked out of the room, but left the room and left me sitting there all by myself. They were outside trying to pull themselves together. I could hear them. Dan and I had absolutely zero risk factors this disease. We had never done drugs, never had a blood transfusion. We were straight. We had been together since 1984. This was 1991. My first instinct, you have to be from Florida to remember. But in the late 80s, we had headlines all over the whole world. People magazine, Newsweek, 2020, the CDC was here, all kinds of research. Belgrade, Florida, AIDS capital of the world. Cases of HIV were being diagnosed in rural Florida, in Belgrade, and around Lake Okeechobee, in people that were not being diagnosed anywhere else in the country. Dr. Ron Lawara was a Department of Health physician and researcher at that time, and he was diagnosing people. Well, I had taught high school in Belgrade, and I thought, my gosh, did I get it from a kid? Break and go fight? You know, what? Anything could happen, right? My next instinct was, well, I know where I was. Where was he? You know, after about 10 minutes, nobody came back in the room. So I could still hear them down the hall trying to pull it together. So I gathered Lindsay together, I strapped her in her car seat, and I drove home. And it was about 4 o'clock in the morning, and I really don't remember anything else that happened that day. But about 4 o'clock in the morning, my phone rang, and it was Mark. And he said, Kathy, we have to go back to college. And Mark knew that when I was in college, I had been robbed and raped and left for dead by 3 men. And I said, Mark, they went to prison. If they had HIV, I would have known. And he said, no, I don't think you would have. And so the next day, we called one of my best friends, who was an attorney in the state's attorney's office in Tallahassee at the time. And it didn't take a lot of digging at all to find a death certificate where one of my attackers had indeed died in jail before I was even ever married. Why wasn't I told? In the state of Florida, before July 1991, the law said, or 92, sorry, the law said no matter what the crime, rape, child molestation, or sexual assault, the victim of the crime was not notified of the attacker's status unless the attacker gave their permission. Even though we managed to change the laws, those laws are still on the books other places. And it's still difficult to get perpetrators tested. And I told Ming when he first called me about doing this presentation, I said, through the lens of today, when people look at the work I've done, some people are possibly put off when they see my name. And that is because the lens of the day, as we work about decriminalizing HIV, right? If you look at the work that I was doing in the early days, it was, how do we get these test results to these women, right? Which was a completely different thing than what we're looking at today, but it is open for discussion. And it is something that comes out on the table a lot in programs that I do. But one of the man who raped me, who died in prison with HIV, had raped 14 other women the state of Florida knew of. All of us were college age women, Florida State, FAMU, TCC. You can just kind of do that math in your head, right? That's a lot of people, and that's a lot of partners, and that's a lot of potential for a lot of babies also to be born HIV positive. At any rate, we didn't tell anybody for the first month. And after the first month, my parents came up for my daughter's first birthday. And my daddy is a political science professor, a Methodist minister, and my parents are flower children that fell out of the 60s. And when my daddy drove up my front yard and he looked into my eyes, he knew there was something catastrophically wrong. We sat my parents down, we told them what had happened, and immediately they began to convince us that everything was going to be okay. A couple of months passed and it came time to give birth to our son. We went to the hospital. Our daughter had been born in 14 months before to the day. 3 nurses refused to come in and help deliver our son. And one of those nurses, not knowing anything at all about us, decided we were horrible people because we were HIV positive and having a baby, considered that child abuse, and called HRS, which is now DCF in our state, to come and take away our children. Now that can't happen. But it was the fear, the anger, and the outrage over that eventually was what was my catapult, right? I gave birth at 2:00 in the afternoon, and at 6:00, there was a knock on my hospital door, and it was someone from HRS to do an investigation. She was an older African-American woman, and I will never forget, as long as I live, when I close my eyes, I see her face. And she walked in the room and she said, "Oh, wow." And what she meant was, I didn't expect to see someone like you in this bed, right? She was expecting to see an IV drug user, a prostitute, someone, whatever. Because again, this is 1991. You don't see people that look like me, right? And she said something really powerful. And she said, "Oh my God, if this is happening to you." And those words just stuck. When she said that, I didn't hear anything else. The rest of the sentence just went away. That's all I heard. So she spent maybe 30 minutes with me. And when she left, I took my own IV out. I put on my clothes. I gathered my baby and I left the hospital. I walked down the hall. Not a single person tried to stop me. I had given birth 6 hours before. I got on the elevator, went down the elevator. I always had change for a payphone. Again, I know that's not a thing anymore, but my daddy always taught me to have change for the payphone. So I called a cab, and this is my one cab experience that I was telling you about earlier. I called a cab, and the taxi cab came. And when I was first diagnosed, I found a support group. It was Oslin House. Oslin House was a all gay man support group, white collar gay men, doctors, lawyers, undertakers, school teachers. And when I had called them, they said, "We do not know what it is to be a woman, but we know what it is to try to live with this disease. So we're here." And so I have been going to group for, a few months at this point. And so that was my safe space, right? So that's where I went. Luckily for me, one of the members of that support group was a doctor with rights, admitting rights, in another hospital, where he loaded me up in his car and drove me back to the hospital. But that was almost 32 years ago. It was 32 years ago. And life's been pretty crazy since then. Lots and lots of positive things have happened, and lots of negative things have happened too. And I don't share those negative things too much anymore, but I think I will today, because I think it's important, if anybody is watching this, or you are thinking about how you're addressing things in rural areas, these are the things people need to know are still reality for folks. So I went public rapidly. Some of you have married. Have any of you married or dated someone really opposite of you? It's fun when you're young, right? It is so fun. My ex-husband is Italian Catholic from the Northeast and grew up in boarding schools. I am as Southern as they come, Methodist. My parents are flower children that fell in the 60s. And we are as far one direction as his family was the other. But when you're young, that's really fun, right? When crisis hits, you are never going to deal in the same way. And we didn't. So not long after I went public, now the guys in my support group tried very hard to keep me from going public. They said to me, Kathy, you don't know what will happen if you do this. You don't know what could happen. And I knew they were right. I was never going to teach school again. There wasn't a school district anywhere in this country that would touch me in 1991. I made plenty of money. I didn't have to work, right? And at that time, people were telling me to make sure my affairs were in order. So how long am I going to have to work, right? And so shortly after I went public, Dan's corporation eradicated his position. They didn't fire him. They just wiped the position out of the company. And at that time, the ADA didn't exist. There wasn't anything at all, nothing we could do. We exhausted our savings. We bought groceries on credit cards. And then one day we woke up and said, gosh, they are going to turn off the lights. We have 2 babies, no jobs, and the biggest disease on the planet. What are we going to do? So we packed up our stuff and we moved home to my parents' house. We filed bankruptcy, the whole 9 yards. My parents were living in Cooliston at that time, which is, again, at the bottom of Lake Okeechobee. My dad was a professor in Belgrade at Palm Beach Community College. And so moving home to that area of Florida was a terrifying proposition. Something had recently happened in that part of Florida that made it absolutely the most terrifying choice anyone could make. And I'm gonna have a quiz for you guys. Can anyone think of anything that might have happened in rural Florida in the very late 80s or the very early 90s in DeSoto County, which is Arcadia? I'll give you that much of a hint. That would have made it absolutely terrifying for me to move home. See, I'm a teacher, you know, I have to give pop quizzes and they're all thinking hard. But if you're watching the recording, no one has an answer, and that's okay, because that's what you're here for, is to learn some stuff today. So Arcadia is where the Ray family lived. The Ray family were 3 hemophiliac sons, and their mother was a nurse for the Department of Health, and their father was an auto mechanic, and they had a daughter. And those 3 young boys were HIV positive, and they had become infected from blood products. And they were in elementary school, and their parents had been told that they needed to let the school nurse know that these kids were HIV positive because they needed their medicines during the day, right? And they did that. And that school nurse then made that very public knowledge, and their house was burned down and they were burned out of their home. It was very, 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 very public news in the country. Oprah, all the shows at some point after that. So my parents' house was about 40 miles from there. So you can imagine that was pretty scary thought, right? Like, how do we manage this? So I had a plan. Now, this plan sounded really good in 1992. Again, these did not exist. So my plan was, I will just speak places local, not locally. I will speak places where no one locally will ever be. Sounded like a good plan. Until about 6 weeks into that plan, and I was in Atlanta, Georgia, speaking in an AME church, and a snowbird from my hometown was there, and she saw me. And so when I got home, she called me and she said, "But honey, your secret is safe with me." Now, this was a fine church lady, but I knew she had called it. We didn't have cell phones, but we did have speed dial. And I knew she had called at least 20 people before she had called me. So we called a family meeting, my mom, my dad, my brother, my husband. We were still married at the time. And my dad said, "This is the work you're supposed to do. If we have to pack up and move, that's what we'll do." So the next day I called a AIDS organization in West Palm Beach, Florida. It was a gay man organization that I had been doing stuff for. And I said, "Okay, I'm ready to really be public. No more pseudonyms, no more this. It's time to be public." And they said, "Okay, Kathy, what is the plan?" I said, "I called you, called you guys for the plan. I don't know what the plan is." So by noontime that day, every single news crew in all of South Florida, from Miami to Tampa to Palm Beach County, was on my doorstep. And by the 5 o'clock news, I was public. And boy, it's been a race since then. So my marriage fell apart very quickly after that. Dan began to self-medicate. Dan began to drink. Dan began to, do whatever he did. My house soon became a dangerous place for me and the children to be. I left him. I didn't divorce him. I stayed for a very long time as far as being married to him. I would go every weekend, do his clothes, cook his food, label it, how to heat stuff up, make his doctor's appointments. But one day he showed up in my yard with a gun, and I figured, okay, I'm not doing one more pair of dirty underwear or socks for this man. And that's when I finally got a divorce. But people often ask, and I know this isn't really the point of this video, but it is the point in rural communities when you're dealing with women. And the question is, why did you stay so long? Why? And for most women, the answer to that question is resources, right? Having the money to rent an apartment, or having the money to even get a bus ticket home, to move home where her family is, or any of that stuff. None of those were the reason I stayed. Zero. None of those. I stayed because no matter where I spoke, and by that time, I had testified before Congress more times than there are people on this teleconference. I had, done all kinds of stuff. But no matter where I spoke, people said to me, "How do you live with yourself knowing you infected your husband?" Harry Reid in a Senate hearing in DC said those exact words to me. And he didn't mean to be mean. It wasn't mean intent at all. But his question never left me, right? And the more people said that to me, the more responsible I felt, the more guilty I felt, and the more no way could I ever leave this relationship, right? So I stayed for a way long past the time I should stay. Husband number 2 came into my life. I'm going to speed up so we can get on with this. But husband number 2 came into my life, Steve. Steve was 15 years older than me. He was a gay man, had been out for a very long time, had been married, grew up in rural Florida on a farm, became an engineer, came out when he was about 24, moved to Virginia Beach and lived in Virginia for a very long time. Started a HIV organization in Virginia Beach that helped nurses who were lesbians adopt children who were being abandoned in hospitals by HIV positive moms, and help military guys that were being put out of the military because of their status. Virginia Beach was one of those locations where people got put out. He helped those folks marry each other so that they had benefits. And so families began to be created very differently in that time in our country. And we used to do a program together called Families Created at Crisis, and looking at the idea that HIV families look very different, but it doesn't mean we're less than a family, right? We look different, but we have all the same parts. And so at that time, he had all this work going on, but he had moved back to Florida and was volunteering, and I was charged when I could no longer teach. DOE made a deal with DOH because they thought I'd sue them. They didn't even realize I wasn't smart enough to try to sue them. But they made a deal with DOH to bring me over to do special projects across the state of Florida. So one of those projects was to bring the AIDS memorial quilt to one of the ruralest areas of Florida. And I ran an ad because I was getting no volunteers, and 2 men walked in, and Steve was one of them. A few years later, he became my husband, and life went on. And in 1999, I was diagnosed with breast cancer on top of the HIV, and it really looked like life was fixing to end. And we weren't married at the time. He had been asking to get married for a long time, and I'd been saying no for, obvious reasons. But we did get married, and we had a great life. We started a foundation, which is the foundation that I run today. And originally we worked with families in rural Florida across the state, and now we work with families in Tanzania, Africa. So at any rate, life is not fair. Steve was not HIV positive, but in 2005, he left for work one day, and a semi-truck driver fell asleep behind the wheel, and I became a widow before I was 40. But life does go on, because if you wake up tomorrow, it has to. And so here we are, fast forward almost 20 years, and I'm still here, and the work still goes on. And my kids, Lindsay and Garrett, are 31 and 32. They're amazing advocates themselves. They are not HIV positive. They've done incredible things. I am now a grandmother, which I never ever could imagine would happen, of 2 amazing grandbabies. And our foundation continues to do great work. And we are an all volunteer organization, and no one gets paid, including me. And that was the founding principles that we had. So in the course of all of this, in those early days, the KKK burned crosses in our yard. We had cats killed and hung on our doors, signs painted to say no AIDS patients allowed here, nailed to the side of our home, death threats, hate mail, you name it, it happened. And it wasn't safe for people to be public in the state of Florida if you were not in a metropolitan area, if you were not in Miami and South Beach, if you were not in Orlando, if you were not in Tampa. It was not a safe place to be. And we've made great strides in that area in our state. And I think the folks on here, anyone on here in Florida will agree to that. However, we have spent the last few years, not the last few years, we've spent the last 8 years sliding backwards. And, we have seen such a loss of access to our school systems under our current governor and our last governor. We had comprehensive sex education in our schools for a number of years. That has gone away. Most of you are aware, we burn books in the state. We take away prevention and that sort of thing. So I got a call 2 weeks ago, and someone told me, I have moved to Florida from out of state. I have adopted 2 HIV positive children. It was a gay couple. The kids are 6 and 7. Is it safe for me to tell the folks in their school? And they're in a very rural county. My answer was not what it would have been 5 or 6 years ago. My answer was, I'm not sure. I don't know. Let me make some calls. Let me talk to some people. Let me find out what the administration is like in the school that you're talking about. Because hate crimes are up in this state. And hate crimes are up, around our country. And is it safe? I don't know if it's safe. And I hated those words coming out of my mouth more than anything I can tell you. And then just a couple of days later, Ming calls about this. And I was like, what divine, what divine timing. because these discussions have to happen. How are we going to reclaim the ground that we fought so hard to have? So many of us have passed the torch. Bob and I have this conversation a lot. You know, my days of activism, I've done them, right? And it's not that I'm not willing and able and ready to do them, but I am the old person. I am going to be 60 soon. You know, I am not the person that people are looking at for that new whatever might be. But at some point, we need to go back to what worked when it worked and see if it's going to still work, because our populations haven't changed. Our access to care, our limit to transportation, our availability of PrEP, our all those things. We're in crisis in many rural areas in our country, but we are definitely in crisis in rural areas in the state of Florida. Miranda happens to just be so amazing at her job, and B, followed a Hapsy that was amazing at his job and was able to fight for things that aren't available in other rural areas. People call all the time to be like, how do they do it up there and we can't do it down here? And it's, you know, people willing to push the envelope and find the loopholes and look outside the box and create something that looks different. And so those are the things I wanted to talk about today. And even though our numbers are small, I hope we can still kind of have those discussions. So you know who I am now. And so let's just open this up and let's have a conversation. Let's start with transportation, because I think if you were to ask, if you were to do a poll of providers of rural communities in our state, at least, transportation would be the number one thing on the list. So let's start there. That's Miranda too. Okay, so let's talk about what you guys have heard in other states as far as transportation availability in rural areas. Ming, have you guys had conversations about that with other rural areas?
Oh yeah, definitely. This is a huge issue in other places that we've gone. I don't know if we've talked about it specifically in the context of HIV, but more generally healthcare. People are traveling half a day, a full day to get to LGBTQ culturally competent care. Trans people are having to travel, if they can even find a provider covered by their insurance or by Medicaid. That, you know, if they're in a rural area, they're having to travel again half a day to get gender affirming care. So I think things changed a little bit during the pandemic in terms of some providers being much more willing to do telehealth.
Right, a huge difference.
Yeah.
Telehealth has been a game changer, I think, in many areas of the country and of the state. Miranda, you're back, and I asked you a question while you were gone, so I'm gonna re-ask you the question. I told these guys that if we were to take a poll of all of Florida, people that service rural areas, that I think transportation would be the number one thing on the list. What do you think would be the number one thing?
Oh gosh, yes, it's been number one, and it's still number one, honestly. That's one of the hardest things to get that barrier done. Because you can offer, you know, bus passes and everything, that's all great, but it only gets you from, you know, around where the mall is, maybe to the hospital and out to the college. For us here in Bay County, I think we finally got a route that goes to the west end of the beach, and it's one route. So if you miss it, you got a couple hours that it takes to get back out to the beach to come into town. And that's also, you know, during the transfers at the college and then at the mall, and hopefully you get somewhere close to where your provider is so you don't have to walk too far.
One of the
And
things
that's just in Bay County.
Yeah, and Bay is your only county with a bus system, right?
Yes, correct.
Right. So I
Yeah,
did
Jackson County has the single, like, on-demand kind of.
the Goodwill, yeah, the Goodwill, not Goodwills, but yeah,
Yeah.
on demand thing. I was going to explain this. I forgot to explain this, so I want to go back just because if people are listening to this, I kind of want people to have an idea. So Florida has 3 very distinctive rural populations. Okay, so North Florida is still very traditional Florida. Florida stops at Ocala South these days. Okay, Ocala North is mostly more native Floridians than not. You know, we're lower Alabama. We are people live where they were born, die where they were born in lots of areas. Now, in the Miranda is in Panama City, so of course you have beach folk, right? But and Butch, who was on but disappeared, he's in Fort Walton and has services in Pensacola. So Pensacola and Fort Walton again have military communities, right? So you've got that transient population, but Floridians themselves, the people we service with the vast majority of the medical care, they're going to be, you know, native type Floridian folks, and lots of farmland, traditional crops. Ocala South, you've got horses, so you got your racehorse kind of community, which is, you know, a whole different kind of worker, and you have citrus. And again, you will have some migrant population with the citrus area, and that sort of thing. But you also have traditional farming of tomato, lettuce, and that sort of stuff too. In the area I'm in now, it is very rural area, is very transplant. It's lots of illegal migrants, because it's tomatoes, lettuce, and, you know, picking. There's tons and tons of farms and tons of migrant, and many of them illegal. We have huge issues with ICE and that sort of thing, showing up at locations where patients are and picking them up. You know, that's something you have to think about and you have to deal with. So when we talk about care and transportation, those are the things we also have to keep in mind, right? Is the access to that sort of thing. So that's a big part of it. So Miranda and I facilitate women's reach. Men's reach also occurs. Men's reach is mostly well-educated gay men, you know, from rural areas, but again, folks with jobs, folks with cars, they're not worrying about daycare, they're not worrying, you know what, they're doing other stuff, right? For Miranda and I, with Women's Reach, no one has a car. Hardly no one has a job. Maybe last year, I think 2 of our women had jobs. Transportation, again, she explained how big, and actually it's a much bigger area because the area for Women's Reach is the entire panhandle across the state of Florida, which is about 400 miles this direction, and, you know, however wide you want to go. And organizations no longer transport people because of liability. Used to, we could at least load up an organization's van, right, and be able to transport people that way. We've lost that even. So that's a constant battle for her and I, trying to get people just to something once a year that they're going to spend the night at for 3 days and get that for free and get them home. We can't, I mean, last year, I don't know, Miranda, how many total did we have last year? 13?
Yeah, I want to say it was about 12 or 13. And we kind of, I mean, if one of the ladies had a car, they just picked up ladies on the way.
Yeah.
I mean, and I think this year we've got one coming from Gainesville, and she's bringing 3 with her that don't have transportation. So it's really relying on our network of Women's Reach ladies.
Yeah. And, you know, hopefully we find money to give them gas cards or, you know, whatever that is, but that in itself is a difficult thing, right? So by far, transportation is our number one issue, whether it's for regular appointments or for care, prep, any of the above. Our second most difficult thing, and again, it's kind of tied right now, is stigma. We still can't get people out because of stigma. And I know stigma still exists in other areas, right? But when you are in a rural area, Miranda has a health department. If you go into that health department, you are going to know someone who works there. That is your only provider. And you are going to personally know someone. There's no way you're not, right? And it's going to be your mama's great auntie and you know, whatever. And how do you get people to come into care when they're terrified of their status to be put out? And that is one thing they've done incredibly well, because they have figured out how to reach people in their own homes at sometimes. But you heard 3 hours. How prohibitively expensive is that, right? How often can you do that, and for how many patients or how many clients can that happen? Another lifetime ago, when I worked for the Department of Health, I had an office in Bartow. Bartow is Polk County, center of the state, extremely rural. Again, no bus systems except in Lakeland at that time. And it served Highlands, Hardy, and Polk counties. Highlands and Hardy more rural than Polk even, and absolutely no public transportation. The HIV provider was the Department of Health. That was the provider for the 3-county area. And so Woody Wilbanks and I helped write the first Title III grant for that area. And we got the money to open a specialty care clinic, which was fantastic, right? I mean, we were on cloud 9. However, the specialty care clinic wound up being a donated building from the county and the state, which was a old hospital that had been closed down for many years and still served as the morgue for the county. And so the morgue backed my office wall. The other side of this wall would be the morgue, right? I did not like working in there at night. But anyway, the only thing that went on in that building was HIV care. Well, that building, if you're there, that's the only reason you're there, right? You might as well have a red flashing neon sign, you know, with AIDS flashing. You know, there was no anonymity. There was no way to protect people. I mean, it was an incredible thing to have this facility, because we didn't have a facility, right? But we had no way to protect people's identity at all, you know? And that is still the case today in so many areas in our state, you know, where we do have such limited access to care, because people can't leave the county, right? They can't go to a metropolitan area. They have to go to the health department. What are they going to do? So that's a big part of it. All right, Miranda, we're down to me and you. Bob's gone too. I don't know where Bob went. So what do you think number 3 is? I say stigmas too. I may have lost Miranda again. Okay, she's in her office. So
I'm sorry, I'm here. What was
no,
that?
I think you're working. So what do you think number 3 is? If we go with number 1 is transportation, number 2 is stigma, number 3?
As far as just barriers for HIV care.
Barriers for care, prevention, treatment, the whole thing.
In general.
I'm thinking.
Honestly, right now for us in Bay is housing.
Yeah.
I've never seen us not be able to pay our rent like we have right now.
Yeah.
Our house rentals have been from like, $900 for a 2-bedroom, 2-bath, whatever. A 1-bedroom, 1-bath is going for $1,500 right now. And when you put, the HUD limitations as far as going through HOPWA, it's just not feasible. And jobs are there, but jobs aren't paying. And if you don't have a house and some, roof over your head to take care of your kids, your HIV comes second, sometimes third, when it comes to food and housing. So that's one of the big issues for us in Bay and our surrounding areas, because Panama's growing so fast that it's trickling out into our smaller outer counties. People are moving out there. So, of course, rent's gonna go up out there because people are having to drive and work, and there's nothing for the folks that can't afford $1,500 a month. Like, you might be working 2 jobs and still not be able to make it.
And that's the entire state. COVID, because we were an open state, we had a bigger influx than even normal of folks. And a lot of those folks haven't left, right? Because they're still telecommuting. They may still be working in DC or San Francisco or New York or wherever, but now they're living in Florida because it's cheaper for them. But they have priced our folks out of places, right? Because those rents have gone up to meet their salaries. And our folks are being completely priced out. I will share something very personal. So the house I live in, I am remarried. And my current husband was one of my first providers when I was diagnosed with HIV. And he too is a gay man. So we got all this going on, right? But he is, when we got married, we both sold our houses and we bought a house together. And the house we bought, it was in 2010. So it was the top of the housing bubble in Florida. It was just busted, right? So we were able to buy we have a 4-bedroom home with 3 baths and an acre of land. And we bought for about $150,000. It should have been about a $300,000 house. That's what it had sold for 2 years before. But because of the bubble and the foreclosure market, we were able to get a really good steal on it. Our appraised millage right now is $675,000. That's 14 years. 150 to 675,000. There's no rhyme or reason, right? Rentals, you just do a search for rentals in anywhere below Ocala, and the prices are just way higher than even in Miranda's area. So we have families tripling up. We are a multi-generational family in my house. My father-in-law lives with me and my parents are across the street. And that's by choice, but there are so many families that is not by choice, it's by have to, right? There is no other choice. So, and then finding housing that will allow that many people in one place becomes a big issue. The HOA Nazis are there. You're not going to have one extra person spend an extra night, that sort of thing. So that's really, really, really a big issue for folks. So I don't know if these are different than you hear in other areas. I have a feeling everybody deals with the same things, and I'm not sure that this is terribly different. I think what does make us different than other areas is our political climate and our dollars that have disappeared. Condoms, prevention. Used to, I could call any health department at any time and say, hey, I have 3 events going on. They say, come pick up five cases of condoms, right? There is not a health department in South Florida I can call and say, hey, I need to pick up condoms. Not one. There is one health department in the state that does make sure I get condoms. I will protect their identity because we will protect their identity. But, you know, prevention dollars are dried up in the state, and, you know, we don't have the ability to go into schools. We used to, any given school year, I would speak in no less than 200 schools, no less than 200 schools. And last school year, I spoke in 3 schools and 4 universities the entire year in 365 days. And, you know, I don't know if you guys are aware of this, but our governor has banned diversity programs even in our universities. So if you're not aware of that, you need to be. They just had a news thing a few nights ago where one of the universities had all of their entire diversity library and everything out in the dumpsters. Literally just were made to clean out their offices and throw everything into a dumpster. You know, so the political climate plays a big part of this, right?
Kathy, can I jump in here? I have some thoughts.
Please.
This has been really amazing, captivating. You're a very captivating person. But I think you knew that. I think that, so you know, because of the nature of my work, I've been in different coalitions, HIV, sex worker, obviously LGBTQ, economic justice, and I've definitely seen how housing has cut across all different coalitions. I think one of the things that's frustrated me by working like within the LGBT space is that we then become, and I think it's similar to HIV, the solutions being very specific to our groups, but there are issues that impact all different communities. And I feel like, to me, we need to be coming together and saying like, this impacts us all. And so like rather say we need a housing program for people who are HIV positive, we need housing vouchers for people who are LGBTQ or whatever identity group. We say, no, we need to make housing affordable for all people, period. And so I am kind of curious, has there been like any political mobilization? Like here's the governor doing all these ridiculous things, saying like, you know, going after abortion, going after trans people, going after gay people, but not actually addressing the lack of transportation in rural communities, not addressing the lack of healthcare in rural communities, not addressing the lack of affordable housing in rural communities or other parts of the state, right? Like, are people actually coming together and seeing and calling the governor out and other politicians who are ignoring their actual day-to-day issues? And if not, like, where is a way that we can kind of come together and name this and say, like, what are we going to do? And I think going back to your saying, I think this is also a moment where I'm just turned 42. I do think there are things that we need to be learning from folks like you who've been around and kind of like, what did it mean to organize when we didn't have all this technology available, right? How do we still get together? You still found a way to get together. And so I'm just wondering if there's a way that we can, I think there's a need to have intergenerational conversations, being like, you have a lot to share, right? Like I learned so much from you in just like this 1 hour plus. And so anyway, so I'm just kind of curious, like, I don't know, those are just some, I have a lot more other things, but those are the things that are just coming out of my mouth right now.
You know, that's, you hit the nail on the head, right? Because we throw the baby out with the bathwater, so to speak. In the early days of our activation in this state, I was telling Ming, I think before you got on, but the AIDS Institute started as Florida AIDS Action Council. And I was one of the founding members of that, right? And our goal was to have people from every area. So not just HIV, just like you said, all the marginalized communities that share the same issues, because we all share the same issues. And we really did a great job of that in the early days. And how do we do it? Old-fashioned phone trees. No, none of this other stuff, right? Old-fashioned phone trees. Phone trees still work. And, you know, they work for get out the vote too. You don't think they don't, because they really, really do. Your neighbors want to talk to you. It's not a text. sitting here, I've had 5 fundraising texts on my phone in the time we've been here. 5. You know, the DNC doesn't need to be texting me. They got my money, right? They need to be, but that's the whole thing. But in our state, so it's become dangerous for folks in positions that depend on state money to speak out, to stand up, to use that voice to say, let's do this or let's do this. And it's polarizing, right? We have a Surgeon General who thinks, you know, the vaccines should be thrown away, and all vaccines, not just COVID vaccines, and that, you know, it's okay if bad people get diseases and die. You know, it's all this thing that we're dealing with, this fake science, right? And so a lot of people have pulled away from the table because I think HIV has become polarized again, right? You know, people are scared to necessarily be attached to the HIV arena because of what that may create for their own arena. And I continue to have these conversations with folks all the time that if we band together, we outnumber them. We outnumber them, you know, we outnumber the crazies, we do, but the crazies are loud, you know, and we're sitting in our little rooms being politically correct and speaking nicely. And, you know, I'm not saying we need to be all act up and throw blood in a room again, but we do need to bring those voices together, and not just in times of crisis. That's the reason we're in crisis now. We were together in crisis. We thought we solved the problem, so everybody went on their own way and then kind of fought for their own pots, right? Because we became almost frenemies, right? Because I may apply for this money or you may apply for this money, but we're not both going to get it. So I'm not going to share this, you know? And so, but when we were together, we were cohesive, and no, everything doesn't line up. We don't have all the same issues, but we have way more in common than we do not, right? And so that's the problem. Now we're back to crisis, and the players don't know each other. The players don't know each other, right? When I got a message, I'll be honest, I came out of my car and I had this text message from Joey Wynn, and he's like, you need to call this number today, blah, 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 they need you. That was all it said. If Joey tells me to do something, I'm going to do it. Joey and I have known each other 35 years, right? If he tells me, I'm going to do it. If I tell Joey, he's going to do it. But have Joey and I sat in a room together since COVID? No, we haven't. No, we haven't. We live 2 hours apart. 2 hours. Have we been in the same room for a single meeting since COVID? No, we haven't in 5 years. If you don't know each other, you can't help each other. If you don't know each other, you're not going to respond to that email that says, you know, please call your senator today on this topic. It goes into the garbage, right? Because I don't know Tyrone, you know, so he works for an organization, I know something. No, you've got to know each other. We've got to reestablish those connections. And this works, but we need that personal too. But if we at least started with this, right? I never thought this was going to work. I'll be honest. You know, when my boss told me that I was going to have to start teaching this way, virtually, I was like, this is never, ever going to work, because I do community health, right? I am like, you are crazy, but it works. It works. I've been pleasantly surprised at how well it's worked and how successful it's been. But I still think people need to come together in person. I need to hug you. I need to feel like I know you and that I can call you because I give you a hug at that meeting. You're going to remember me, right? And so I just think all the players have to come together. And I think really the fact that there's nobody on here is an example of that. Ming named off 10 players that he thanked for being partners. I have friends at every place he read off. I know people at those organizations. Where are they? They couldn't put one person on today. You know, I don't know.
Thank you so much for saying that. I definitely agree with you. I'm an organizer, and I think that personal relationships matter. And I think as much as technology has been helpful, I think it's easy to take for granted relationships. And I think that we need to invest more in time in actually coming together and learning each other. And I think that today seeds were planted. And I know it's a small group, but I think that it's from here where things can grow. And so it just means a lot to me that you gave this presentation your all. Like, you still fully showed up. You could have been like, well, there's a small group. You didn't do that. So I just want to say thank you for that. And I feel very inspired by this conversation. And I hope that we can, we can cultivate that seed and let it see it grow in Florida and all around. So thank you.
I appreciate that, Tyrone. I really do. I'm a firm believer. It doesn't take a whole lot of people in the room to make that ripple, right? And it's those ripples that make the change. And we all have to be showing up right now. It's just like, I'm assuming most of you have been watching TV the last 4 nights, late into the night, as I have been, or at least DVRing it if you haven't. And if you haven't, do not tell the social studies teacher you didn't. Okay. So, and such movement and passion, right? But what happens today? What happens in the next 80 days? Do people stay motivated? Do GLBT folks turn out the vote? Do people vote for their own interest? Do people even know what their own interests are? And those are the same things. It's no different whether you're talking elections or you're talking agencies working together or individual communities or an individual church trying to start a food pantry. It's relationships. And how do you build those? And it's got to be multidisciplinary. In the rural areas, it has to be, right? There are not the resources. Miranda's clinic, they do everything. It's a full-on health department. Yes, HIV, but it's also the place somebody's going to come when they're pregnant. It's going to be the place they're going to bring their child when they have lice, and it's going to be the place somebody's going to come to get PrEP, and it's going to be the place somebody comes when they're 92 and they need their Alzheimer's medicine, right? So it's bringing all those disciplines together and having those conversations that are just so important. So, Miranda, you got something to add? She may be on the phone. Nope.
No, yeah, I'm still trying to navigate this new phone. Yeah, you wouldn't think that a new phone would be this handicapping, but yeah, man.
We're all Miranda.
No, I really don't. Oh, don't. Oh my goodness, I'm feeling it right now for sure. No, it's just, every day's different. And as far as just trying to get our clients in the door is the hardest part, and once we get them here, that's one of my things is if somebody made it here, you don't know what they went through to get here. So if they made it here, we're going to make our best effort to take care of anything and everything that they need. They might have to hang out with us for a little bit, a couple hours. A new positive might take 4 hours by the time we get through everything. But I'm not gonna turn somebody away. That's not what we need to do. If we can make it work, we're gonna make it work. And that's why we do have all of our programs here in one house. If we've got somebody that comes in for a PEPW, they're getting their pregnancy Medicaid, and they test positive for HIV. Just come on in, sit right here. We're going to get a doc. We're going to walk through it. Short of having a mental health counselor on staff, that would be awesome to have, just for the processing of everything. But and then there's also our partner services. So there's a lot of times that it might turn into, you know, a test and treat and then a prep, or an NPEP situation just because of, you know, activity. But we just try to take care of everybody. It's one of those words like, okay, you know, if your mom was on the other side of this counter, what would you do? So I don't know.
You know,
And it's hard when
go ahead. I'm
it's
sorry.
hard when other people don't feel that way. No. I was just gonna say it's hard when other people don't feel that way. You know, it's just a job or whatever. But that's what makes our health department special.
It does. And that's actually what I was going to
All
say.
of our all of our other counties pretty, you know, they'll do what they can. But for the most part, when it comes to NPEP or HIV test and treat, they'll try to get them down here to Bay County to see us. So there's no long time wait, or, you know, if AHF can't get a bus over to see, or if the person doesn't want that visibility in their yard, they want to be private about it. Just all circumstances. So, but no, I enjoyed the talk.
One of the things that that I think is probably the most controversial thing I'll say today, but in the difference between now and 1991 is the first 10 years of activism for me, which was in DC on the streets, in Tallahassee on the streets, and, you know, wherever. And but the first 10 years of my work in that public arena, if you were in that arena, you were there for a reason, right? You were there because either you were positive, somebody you loved was positive, whatever it was, but this was not just a job. So much of today, jobs and activism are just a job. And if somebody called Ming, and I'm not saying this is Ming, but if somebody called Ming and said, oh, we can pay you $3 more an hour to come to epilepsy, right? Or we can, brain injury needs you, Tyrone, you know, here's an extra $500 a month, then you're gone, right? And so in Miranda's area, and that's what I was talking about when I said North Florida is a completely different being than the rest of the state. You have people that are from there, grew up there. This is their life, right? Miranda makes pickles and homemade wine and jelly on the weekends, and everybody in her area knows that, right? And they know that she cares and that she wouldn't jump for 50 cents more somewhere, right? And so that is the place that in lots of rural areas in different states, that is the place to start the conversations and capitalize in those areas that have that stick-to-itness, you know, that dedication that's not going to go away. It's not just a job. I really appreciate you guys being here. I appreciate you having me.
Yeah, that's a perfect note to end on, I think, Kathy. Thank you so much for jumping in on this kind of, I know, at the last minute. I'm so grateful to you for sharing your story, sharing your knowledge with us. I think what you said about relationships at the end there too is giving me so much food for thought in terms of that's also something I've really been trying to value in my work, but that it sometimes feels that activism as a paid industry doesn't value, even though that, you know, they're happy to use us up and burn us out. But I think actually the relationships are what sustain us
They are.
in this
And
work. I can't wait to have lunch with you.
I can't either. And, you know, those relationships are what sustain us. If you don't learn anything from Miranda or Bob or I today, the one thing that we all think it's important for the younger generations to understand is that you must take care of yourself in this. You know, I didn't have time to deal with burnout, right? I had to just keep going. It didn't matter. This vacation I'm taking is the first vacation I've been on in 10 years. 10 years. I haven't had a vacation in 10 years. Don't do that to yourselves. Don't, and those folks that you work with, today we live in a society where people are scared to trust the people they work with. If that's the case, you need to work somewhere else, because I can pick up the phone. I may only see Miranda in person 2 times a year, and we live it's a 9-hour drive apart for us. Okay. But I can pick up the phone and say, Miranda, something's happened, and she would be here in that 9 hours, and the same for her. And those are the relationships each of you have to find if you're going to do long-term activism, because you can't survive any other way. So if anybody is hearing this, watching this later, my Facebook is my whole name. So it's Kathy Robinson Pickett. My email is hiveducation@aol.com. I am old school. That email has been my email since 1993. Now that doesn't mean I don't have other ones, but there's no one that's never heard me speak that can't still find me today. So I appreciate you guys, and please reach out if there's anything else I can do. And Miranda, I so appreciate you for jumping on. I literally messaged Miranda an hour before this because I had forgotten to tell her about it. So certainly glad she got on today. So
thank you, Miranda. Really appreciate your input and your wisdom, and hope you try some of those pickles and jam.
Yeah.
Yeah, Betty, if you come to North Florida, you got to stop in Panama City and see Miranda.
All right. I'm
Yeah,
gonna
that's what I was gonna say. Just
Oh,
give
go
me
ahead.
a heads up. We'll have it ready.
She will. So, all right, gang.